Welcome back to ID Rapid Reviews. Today we're discussing the Curto study published in PLOS Medicine. This randomized trial by Durovny and colleagues evaluated two regimens for tuberculosis preventive treatment among people without HIV and with evidence of TB infection. The study compared a 1-month daily regimen of INH and rifapentine, also known as 1HP, compared with the standard 3-month weekly regimen, or 3HP. Tuberculosis preventive therapy is essential for TB control, but traditional 6 to 9-month regimens have consistently low completion rates. Shorter regimens, such as 3HP, improve feasibility, but 1HP, the ultra-short 1-month daily regimen, had been studied primarily in people living with HIV. This trial was designed to answer a practical question. Can 1HP be used safely and acceptably in people without HIV? Curto was a peer-reviewed, randomized controlled trial conducted in Brazil, with enrollment sites in Rio de Janeiro and Manaus. Importantly, this was a pragmatic trial focused on acceptability and safety, rather than on measuring tuberculosis prevention efficacy. The study enrolled 500 adolescents and adults aged 15 years and older. All participants were HIV negative, had recent household or occupational exposure to TB, and met protocol-defined criteria for TB infection. Participants were randomized 1-to-1 to 1HP or 3HP. Participants assigned to 1HP received daily INH and rifapentine for 4 weeks, while those assigned to 3HP received higher dose weekly therapy over 12 weeks. After the first observed dose, treatment was self-administered in both groups, reflecting real-world program conditions. The trial had two co-primary outcomes. The first was treatment success, defined using a strict composite: self-reported completion, pill counts, and pharmacologic confirmation involving detection of the medications in at least one blood or urine specimen. The second was safety, defined as grade 2 or higher targeted adverse events, or treatment discontinuation due to side effects. Treatment completion, defined using pharmacologic monitoring in conjunction with pill counts and self-report, was high. 89.6% of 1HP recipients and 84.1% of 3HP recipients successfully completed treatment. The site-adjusted risk difference for completion was 5.2%. Although numerically higher with 1HP, this difference was not statistically significant. A sensitivity analysis using a stricter definition of treatment success requiring detection of INH or rifapentine use at 2 separate testing occasions suggested more frequent adherence in the 1HP group than in the 3HP group. These findings suggest that shorter regimens may reduce missed doses even when overall completion appears similar. Primary safety outcomes favored 3HP. Targeted adverse events or treatment discontinuation occurred in 16.1% of 1HP recipients compared with 10.4% in the 3HP group. Treatment discontinuation due to adverse events was similar between groups, with 7.2% discontinuation in the 1HP group and 4.4% in the 3HP group. Several limitations are important to note. First, Curto was not designed or powered to compare tuberculosis prevention efficacy. However, the authors note that prior studies have found 1HP and 3HP to be non-inferior to standard of care INH regimens in other settings and populations. A key limitation was the reliance on self-report for overall adherence assessment, although this was supplemented by pill counts and pharmacologic monitoring at 2 time points. In summary, both 1HP and 3HP achieved high treatment success and were generally well tolerated in people without HIV. These findings support 1HP as a safe, acceptable option for TB preventive therapy. That concludes our review of the Curto trial. For additional details, see the full article in PLOS Medicine. Thanks for watching ID Rapid Reviews. Please be sure to like the video and subscribe to the channel. See you next time.